Hello. So I'm going to talk mostly actually about other people's successes and the successes of our program rather than my own because they're much more interesting. So I'm just going to give you a really quick overview of our sickle cell program's research portfolio and what we have going on and how we got there. So we have a very rapidly growing portfolio of research, and it's particularly kind of amazing to me because all of this really started back in 2014-15 when we got our first COBRE award. Prior to that, we really didn't have much in the way of sickle cell research going on. So this table is the one that went in with our Cohort Renewal application last year, and you can see that over those few years we had a lot of investigator-initiated studies that were part of the COBRE, but also some pharma trials. We became involved in several consortiums and enrolled had a total of 758 enrollments over the 6 years. On a variety of different studies, which is kind of amazing since we only have 300 sickle cell patients in our practice. So we were very excited to find out this summer that our COBRE was renewed for another 5 years. It's a $10.6 million grant, builds on the strengths of our first COBRE, and our PI this time around is Andy Kolb, who, everything that he touches is magic. And so we're very fortunate to have him leading us. And the components of this COBRE are an administrative core led by Andy, a clinical and data informatics core, 4 target projects, which I'll briefly go through. And we have the ability to add up to 4 pilots. And as the target investigators move on to their own independent funding and finish up their projects, we'll be able to add up to 3 more projects. Central to this COBRE is mentoring of junior investigators, and this is actually part of the administrative core, but you can see that Andy has developed a very clear and detailed mentorship strategy that he's going to be, that we're going to be using for all of the investigators. The clinical research and data informatics core is co-led by me and by Erin Krauge, who's the director of clinical bioinformatics. And the goal of this is really to create a robust platform to support investigator-initiated clinical and translational research in sickle cell disease. And at the heart of it is the Clinical Research Committee, which is really the center where we're going to be overseeing the trials that are going on, evaluating opportunities to participate in new studies, both COBRE and non-COBRE, and supporting the investigators. Another part of this that's very important is our quality outcomes team to ensure that we continue to deliver guideline-based high-quality care. And part of this is a community health worker program, which is new and we're very excited about. And then the third aim is to really maintain our EHR-informed sickle cell knowledge base that we built during COBRE 1 for managing clinical and research data, and Erin is very much at the heart of that. So I'm just going to run through the projects that are part of the COBRE. Project 1 is led by Corinna Schultz, who's one of our hematologists. And newborn screening now is mandatory in all states and identifies patients with sickle cell trait from the time they were born, but unfortunately, a large number of patients don't know about their sickle cell trait status. Somehow it's not getting conveyed and not getting into their medical records. So her project is aimed at identifying barriers and facilitators of PCP documentation and disclosure of sickle cell trait using qualitative interviews with the PCPs. and to increase their documentation and disclosure during infancy, and also to facilitate conversations during adolescence. She's planning to develop a toolkit and video intervention that can be used by PCPs. Project 2 is led by Amy Hildenbrand, who is one of our psychologists and works closely with our sickle cell program. The background for her project is, despite the fact that we have outstanding evidence that supports the use of hydroxyurea for all patients with sickle cell, the uptake has been very slow, and really only 40 to 65% of youth with severe sickle cell receive high hydroxyurea, and particularly adolescents and young adults have very poor adherence. So her project goal is to develop and evaluate a shared decision-making intervention that's tailored for AYAs with sickle cell, their caregivers, and their healthcare providers, that includes tools for clinicians, decision aids for the parents, and clinic-based implementation tools. Project 3 is led by Steph Guarino, and her situation is unique because she shares her time between Nemours and Christiana, where she leads the adult sickle cell program, which is run out of the Center for Special Healthcare Needs and has become an amazing resource for our patients as they transition. And she is looking at stigma and racism. So her first aim is to examine the relationship between sickle cell related stigma and self-efficacy ratings in patients with sickle cell using data from the IMPORT study, which is a federally funded observational study of sickle cell patient experiences in seeking health care. And she's gotten access to that data. Her second aim is to look at the effects of experience of racism in a healthcare setting, sickle cell related stigma, and racial identity on self-efficacy and chronic pain in adults using qualitative interviews. And she is going to try and demonstrate the feasibility of a sickle cell specific chronic pain self-management curriculum, which she is developing, which will be used in peer-mediated groups. And she'll be training peer leaders and who will lead the intervention. And then the fourth project is led by Jing Jin, who's one of our ophthalmologists and has a long term interest in sickle cell retinopathy, and actually has been working on this study actively for about 5 years in our combined heme ophthalmology clinic. And she, in this study, is going to try and characterize the association between changes in the retinal circulation as demonstrated by fluorescein angiography and structural damage detected by optical coherence tomography, and to define relationships between retinal damage and ischemic brain damage on MRI, MRA, and also by TCD. She's already been able to show an association between retinopathy and ischemic brain damage, which is a new finding that hadn't been previously reported, and to look at associations between ocular findings and baseline markers of disease severity and lab data. There's an RFA out right now for our first pilot project, so hopefully we'll have that identified sometime in January. So I was one of the target investigators on the first COBRI, and Rob knows that I had my struggles, but I'm still actually finishing up a study using the carryover from COBRI 1. And that study is entitled Specialized ProResolving Mediators in Children with Sickle Cell. There are several lines of evidence that support that sickle cell is a chronic inflammatory state, with inflammatory mediators playing a big role. Omega-3 fatty acid supplements are well known to provide beneficial effects in a number of inflammatory disorders, and they are converted to potent anti-inflammatory and pro-resolving lipid mediators called SPMs that can promote clearance and resolution of inflammation. And there's pretty strong evidence both in humans and in mice supporting the anti-inflammatory effects and clinical benefit of omega-3 fatty acids in sickle cell disease. These are mostly small studies, So my study is hypothesizing that children with sickle cell at their baseline state of health will show significant decreases in levels of DHA and EPA derived SPM profiles when compared to healthy African American controls, that the differences will increase with age and for those with more severe disease, and that they will correlate with levels of inflammatory biomarkers. And we're hoping to identify perturbations in these lipid mediators that potentially could be targetable with specific omega-3 fatty acid formulations. And so, we've enrolled all of our patients and collected blood samples so that we can compare SPM levels between our sickle cell patients and controls. And Dr. Setti right now is working in the lab to do all of the assays, and we're hoping to have a data set soon that we can start to look at and finally finish up this project. And so just last, we do have a number of things going on that aren't related to the COBRI. We belong to a number of sickle cell research consortiums. There's the Displaced Consortium, which is a group of hospitals led by Julie Cantor in Alabama, looking at ways to improve adherence to transcranial Doppler screening for stroke in patients with sickle cell disease, and we've been working on that for about 4 years. There's the ENGAGE study, which our psychologists are working on, which is looking at addressing barriers to hydroxyurea uptake. We're part of a sickle cell transplant consortium called STAR, and we have an open study as part of that looking at unrelated bone marrow transplant for non-malignant hematologic disease, including sickle cell. We are part of the ASH Clinical Trials Network, which is a newly formed network in partnership with Johns Hopkins. We've just joined the National Association of Sickle Cell Centers, and will be starting to put patient data into their national registry. We have one pharma study currently open. It's an expanded access study for one of the new disease-modifying therapies called Oxbryta. And and Dr. Hildebrand is running a virtual reality study for teens with sickle cell, which they're pretty enthusiastic about. And then finally, we're using some COBRI funding to try to ramp up our enrollment in the Nemours Biobank so that hopefully we will have patient samples and clinical information for people who want to do projects down the road. And that's all I got. That was a very quick overview. I don't know if I